I'm at Maddox New Prater Eye Center, and so often when we think about the eye center, we think of it as just a surgical center, but it is more than that. As a matter of fact, they're kind of on the forefront of a treatment that many of us could benefit from. With me is Dr. Matt Smith, Doctor of Optometry here at Maddox New Prater. Good to see you, sir.
Hello, Tom. How are you?
We're going to talk about something that I think a lot of people have heard of, but may not know what it's all about, and that's called dry eye. Would you explain that?
Sure, Tom. There's two types of dry eye syndrome. And dry eye syndrome as a whole gives patients various complaints, from having stinging, burning eyes to feeling like there's something in your eyes. Red, irritated, even itchy eyes are common with dry eye syndrome. And some people simply don't have enough tears. But the majority of people with dry eye actually have a kind of dry eye that's called evaporative dry eye. And that type of dry eye is because the oil glands in the lid don't work as well as they should. Right. And the tears that you produce simply evaporate instead of staying in place and keeping your eye moist.
Now, what is it that causes dry eye? Because I think, when I think of dry eye, I think of, okay, allergies or, pollutants or something like that, just making my eye dry. It's a lot more than that.
Yes, there's various subtypes of dry eye, but the two categories are you're either not producing enough tears, and that can be from certain systemic diseases, medicines you're on, or simply aging of the tear gland that produces tears. The other type of dry eye we term evaporative dry eye. And evaporative dry eye is when the oil glands in the lid either don't produce the correct oil or they're plugged and not producing any oil at all. And for that type of dry eye, we have a new treatment for.
And it's one of the only places anywhere you can find this. Tell me a little bit about it.
Right. We're, as far as I know, the only clinic in Southwest Missouri that's giving this treatment. And in the past, we've just been treating the aqueous deficient dry eye with artificial tears and ointments and even punctal plugs, or a medicine called Restasis. But come to find out, most of the patients we have actually have the evaporative dry eye. And for that, we can do warm compresses, which don't work very well. Sometimes we'll give an oral antibiotic to try to help the oil glands produce a better oil. But the new treatment we have, called LipiFlow, really gets to the root cause of evaporative dry eye.
Okay, let me ask about that in just one second. But you mentioned warm compresses, and I mean, even I've heard that. Put warm compresses. Why doesn't that work?
Warm compresses can work a little bit, but the meibomian glands that are faulty in evaporative dry eye are on the back surface of the eyelid. And when you put warm compresses on the outside, the heat doesn't get to the back portion of the lid in sufficient quantities to liquefy the bad oil in those glands. The other reason is compliance. Patients usually don't want to do 10 or 15 minutes of hot compresses twice a day to help. So the LipiFlow can do all that in 12 minutes.
Tell me about LipiFlow then.
LipiFlow is a mechanical and thermal treatment to unblock and evacuate the bad oil in the meibomian gland that causes evaporative dry eye. It's a device that's computer controlled. There's a little activator, it's called, that goes into the eye, warms the back surface of the lid to 108 degrees, and it massages the outside of the lids and expels all the oil from the gland.
Right. Now, this is a simple procedure?
It's very comforting to the patient. The patients we've treated have reported it as being very pleasurable. It takes 12 minutes. It's done in one of our exam chairs. The patient's reclined, their eyes are numbed, and these devices are put in their eye. There's no pain or discomfort. It's over in 12 minutes.
That's very important. Anyone who has their eyes worked on, no pain or discomfort. If people want to know more about the treatment and ways that Maddox New Prater can help them, if maybe their physician has said, well, you have dry eye, how do they get that information?
They can call our clinic, 886-EYES, and call us up, and we can schedule a dry eye appointment.
All right, Dr. Smith, thank you very much. Appreciate you talking with us. So there is something new. If you have dry eye, suspect you do, or your doctor has told you to see a doctor of optometry, you might want to come to Maddox New Prater.